Hi, it's Connecticut personal injury attorney Ryan McKean here. I'm here with Connecticut medical malpractice attorney Jake Kosienda. Hi, Jake.
Hi, Ryan.
Hey, Jake, one of the things we get asked a lot is how do I know who to sue in a medical malpractice case? And, maybe in the 50s you had one doctor who, had an office or maybe came to somebody's house and it was relatively clear who was providing you care. But, in today's really massive healthcare conglomerates and all sorts of different people, different specialties collaborating. It could be people in labs across the country. How do you know who to sue in a Connecticut medical malpractice case?
That's a really good question, Ryan, and it's one that's not easily answered. Though, as a patient, you go through and you may see one clinician, a doctor or a nurse APRN. There's a lot of people and personalities behind the scenes working towards your medical care and providing support for those people that are involved in ultimately your treatment. And you may never know who they are or see what's going on. For example, one order of a lab will result in at least one, possibly two or three doctors reviewing those labs and being responsible for those labs. There's someone who drew the blood. There's the lab itself who ran the tests and may have contaminated a sample or done something wrong. Same with radiology. You have an x-ray done. There's a radiology tech that does the radiology. There's a radiologist who reviews it. There's someone who reports it to your physician, perhaps an emergency room physician, all with one test that all you see is you had an x-ray done. So it's really sometimes very difficult and not obvious to the average layperson, the person out there who's the patient, to know who's involved and who did something wrong, who did the thing that's wrong that resulted in your injury. That's sometimes hard to sort out, and that's what I do as in my profession to go through this when someone has a bad result and doesn't understand why or who was responsible.
So, do you go through that by really looking at the medical records and then piecing together who it was referred to and getting maybe records from them or data from them? I mean, how do you go about figuring out what at least appears to me to be a very complicated factual issue?
So the very first thing we have to do always is get the medical records. There's laws and regulations that require documentation of your medical care by everyone who's involved, and their names will appear in it, and what they did and didn't do will be in those documentation as well. The irony of it is there's things out there like MyChart and other, they call them patient portals. The laws require that these be established. The information you get from them is not everything that actually exists. For every one or two pages in your patient portal you may see, there's probably a dozen or maybe even 40 or 50 more pages in the background of medical records with people involved that you never knew were involved in your care. And so the very first step, get the medical records, not the MyChart or the portal papers, but the actual medical records from the doctor, the practice, the hospital, the lab. And after that, we go through them and start sorting through and figuring out all the steps and all the things that were done. And we can figure out where things went wrong and who was actually involved. And that takes time and that takes effort.
So, I mean, like so many things related to Connecticut medical malpractice, it's complicated, it takes time, it requires a lot of detail work, and it requires knowing where to look. So if you're out there and you're wondering if you have been a victim of medical malpractice or a friend or loved one, give Attorney Kosienda a call, 860-471-8333, and let him put his experience and expertise to work for you.